To ensure the furthest left behind have the opportunity to receive essential sexual reproductive health information and services, the Safeguard Young People program partnered with civil society organizations to implement CSE for young people who are blind and partially sighted in 4 institutions. In addition, the program facilitated access to SRH and COVID-19 messages in accessible formats where materials were printed in Braille. Young people with disabilities were reached with a targeted campaign on access and use of condoms to prevent HIV, STIs, and unintended pregnancies, the Condomize campaign, the first of its kind.
We started with the SYP program in the year 2020. That was when the COVID-19 pandemic had hit our country, Botswana. By then, UNFPA, through the SYP program, supported BAPs in brailing risk communication messages of COVID-19 so that persons who were blind and partially sighted could be able to access the information and the messaging that was going about the COVID-19 pandemic. We didn't only end there, but we also had risk communications of SRH during COVID-19, because now young people, especially young women and girls who were pregnant by then, were neglected, and some, because of lockdowns, couldn't even access all the SRHR services. From there, we also had the Comprehensive Sexuality Education Program, CSE, that was targeting young people with visual impairment. This was the first ever initiative that was done in our country.
Last year, we ran CSE programs. Ra rutia ka yone sexual reproductive system le tsone di contraceptives ine ya re thusa hela thata ka gore re ne re sena information ya tsone dio tsenetse mo gongwe ke gore CSE e re thusitse gore re nne confidence, we choose good decisions.
The program has established the network of young people with disabilities, the first of its kind, to ensure inclusion of voices of persons with disabilities.
And this program really did a lot of wonders. We started seeing young people with visual impairment being assertive, being able now to talk and discuss their sexuality openly. And the sessions that we were doing with the young people with visual impairment, they were done by other young people with visual impairment who went through training that was also supported by UNFPA. And these trainings, we did them, the sessions, we did them in 4 institutions that we have here in Botswana. One of the noticeable achievements that we did through this SYP program was we had the first ever International Day of a Girl Child, and we had young women and girls from Pudlohong School and the other 3 institutions that we were serving. Young women and girls were opening up about their sexuality.
In addition, the program has also supported piloting of a global curriculum that was developed by UNFPA and Women Enabled International. Young people with disabilities in Botswana were trained to ensure that this curriculum is well developed and respond to the needs of the targeted population.
One of the innovative activities that we implemented through the support of the SYP program was braille labeling the male condoms. Labeling the date of expiry, we also labeled the flavor or the scent of the condom. And also brailing the instructions on how the male condom was used safely. This initiative we rolled out to all over in Botswana, more especially where we know that there are institutions or some organized group of persons who are blind and partially sighted.
Some of materials like the condom dina di kwadile ka braille le ane reproductive system parts ine le botsen braille re ne re khona go ipalla rona ka gore ga di kwadile ka print ha re khone go di bona.
We really would like the SYP program to really help us with this initiative, to expand it so that more condoms will be labeled with braille, and so that it can also become a custom that each and every company that the condom producing companies, they can also have braille labeled condoms.
The programs tse ne di tshwana le CSE re letsa gore le ne le di tsweledisa ka gore bana ba sekolo ba tswa bangwe ba tsena gore le bona ba khone go tsa information e good. Iska ya ruta hela ba le one be go ya mahela ho